Hello, YouTube community. Today I'm here to shed light on the corruption within the Veterans Administration, including hospitals and clinics. Veterans must be given options beyond the Veterans Administration hospital. Allow me to introduce myself. I am a proud Coloradoan, having retired from the United States Air Force in 1994 and from federal service in 2015. With a degree in human resources from Regis University, I've dedicated my career to law enforcement and human resources. After persistent advocacy for my medical needs, I achieved 100% disability, thanks to my private doctors. Not the VA doctors, my private doctors. I'm growing increasingly frustrated with Congress claiming that the VA hospital provides quality care. But veterans continue to voice complaints about inadequate services. Some VA hospitals may function well, but that is not the case in my area. My experiences with the VA hospital and clinics have been disappointing. Initially, I sought care from the Lakewood and Denver VA hospitals, but found the quality lacking, prompting me to return to my private doctors. In 2015, after relocating near Fort Collins, I decided to give the VA another shot. Unfortunately, I've seen a series of primary care doctors due to staffing issues, making it difficult to establish a consistent care routine. Instead of being offered care in the community, I've been shuffled between the NoCo VA clinic and the Cheyenne VA hospital, which is over an hour from my residence. Assessing dental care has been similarly problematic. After struggling to get adequate care through the VA dental program, I opted for private dental insurance. My private dentist shared his issues with the VA hospital, further highlighting the inadequate services veterans face. Despite being entitled to care in the community, the VA seems unwilling to facilitate it, likely to maintain their funding numbers. Moreover, I believe there should be a balanced representation among staff, not exclusively male veterans, to foster a more inclusive atmosphere, especially for those of us veterans who were harassed by bad male veterans in the military. It is frustrating to hear from Congress that the VA hospital is the sole provider of quality care when my experiences tell a different story. My private doctors, in contrast, offer personalized and compassionate care, know me by my name for over 30 years, instead of being a number at the VA hospital and clinics. Veterans deserve more than inferior medical services. We should have options. The VA hospital system is outdated, but Congress continues to fund it despite its inefficiencies. Additionally, hiring practices have been perplexing, with potential employees leaving due to inept management, and financial mismanagement is frequently coming to light. If a government agency cannot manage its funds effectively, more funding should not be the solution. With a proposed $435 billion in funding, that's right, $435 billion in funding, it would make more sense to downsize the existing VA and provide veterans with a choice of an insurance card instead of care in the community, which does not work because the VA hospitals is withholding these services. Many veterans already have some form of TRICARE, making it smoother and more efficient option to utilize their program, including the TRICARE VA and a dental VA insurance for those veterans to qualify for dental insurance. Dental insurance is cheaper than paying for dentists, hygienists, and all the equipment they need. Congress, financially, this would save taxpayers millions of dollars. It would be a choice from the veterans. If they want to use the VA, they can use the VA. If they want an insurance card, they can have an insurance card. Finally, the VA doctors see only about 6 patients a day because they are allowed 1.5 hours for new patients and patients 65 years and older. Returning patients for 1 hour. I only spend 30 minutes with these doctors. This is what is contributing to the long wait times for veterans to see doctors. This is a secret that the VA does not want veterans to know, whereas the private practitioners see from 20 to 30 patients a day. This is a big difference, and this policy should be changed. Since the VA hospital is hemorrhaging doctors and nurses, downsizing the VA hospital would alleviate the doctor shortages at private hospitals are better equipped to treat veterans. The number of veterans who live in Cheyenne is 10,500, whereas in northern Colorado has 37,000 veterans. But not all veterans go to the VA hospital. The Cheyenne VA hospital was built in 1934, and it has fallen apart. They have not been able to hire emergency room doctors. That is the reason the ER has been closed. Now they are building a new emergency room? This makes no sense. It is a waste of taxpayers' dollars. From a financial perspective, it makes more sense to downsize this hospital to a clinic because they don't have enough veterans going to that facility where they only have 10,000 veterans there. But they push the veterans of northern Colorado to go there when they should get care in the community. I'll be signing off, but next week I will discuss the corruption in the VA hospital, specifically how bad managers who are veterans have infiltrated the Cheyenne, Wyoming VA hospital and corrupted the NOCO VA clinics. If you watch the movie A Few Good Men, Colonel Nathan R. Jessup, played by Jack Nicholson, authorized a code red. Tom Cruise, a recent lawyer, won his first court case. The second in command at the Cheyenne VA hospital was the security police squadron commander, and he reminds me of Colonel Jessup in the movie. I have shared pictures of the bad managers, veterans at this facility who are abusing their authority, hiring friends, family members for high-paying jobs that they are not qualified for has created a toxic work environment for the workers. I will explain more in my follow-up YouTube video.